Hi, my name is Dr. Lewis Haynes. I am the founder and executive director of Arcus Behavioral Health and Wellness. And I'd like to speak to you about what makes us different from other nonprofit community mental health agencies, as well as group practices that can exist out there in the field of psychology. So, there are many barriers that people face in being able to obtain services regarding mental health. And one of them is the fact that not everyone has insurance. People are falling through the cracks still in terms of access to care, partly because, unfortunately, our system ties employment or healthcare to employment, which already marginalizes and creates a lot of issues. At Arcus, we believe that healthcare is a human right and that everyone deserves access to high quality treatment, whether that's healthcare, medical healthcare, or mental health care. Although there are a number of public safety networks, including Medicaid, Medicare, that exist, unfortunately, people are often faced with the difficult decision of deciding, which is more important, healthcare or employment. A number of jobs don't offer health insurance. And unfortunately, Medicaid also has certain salary kind of requirements that if you make a certain amount of money, you no longer qualify for Medicaid. So some families are really faced with a difficult choice of deciding, do I continue working and pay my bills, or do I have access to health care? Maybe some jobs are actually able to afford some benefits. And you might think, well, if you have health insurance, then you're probably good. But that is just frankly not the case. Although the Affordable Health Care Act definitely helped access to health insurance for a number of thousands of people, the plans that are available on these exchanges are often these high deductible plans, which means that the benefits do not kick in until the patients or members have paid out of pocket a certain amount of money, sometimes upwards of $3,000, $4,000, which really makes access pretty cost prohibitive for people like that. So people with insurance are not good. Just because they have insurance, that still means there's limited access to care. In fact, I would argue insurance companies are sort of banking on us not using those benefits, unfortunately. What separates us from other non-profits as well as group practices? Many group practices are willing to accept insurance, and the therapists are paid a percentage of what they bring in. That creates problems for a lot of reasons. Although it does incentivize productivity and it gives us a little more autonomy on how much money we're bringing as providers, it de-incentivizes accepting certain insurance plans that may not reimburse very competitively. It de-incentivizes helping people who do not have insurance. Altruism is not rewarded systemically. There's no tax write-off, there's no tax benefit to a provider in a for-profit agency to accept a client like that. At the same time, more traditional nonprofits who accept primarily Medicaid or Medicare still have a lot of issues with employee retention, being able to pay the bills, and sustain the therapists, the clinicians, the providers with a livable wage, really. So, what separates us is we strive to be sort of middle of the road and be able to find that balance that we believe that other nonprofits and for-profits have not really found. And what we'll do is when the clients are not able to afford our sliding scale, we will use subsidies that come from grants, that come from donations, from generous donations such as yourself, who really believe in our mission of increasing access to high quality mental health care to the public at large, particularly to those who are most marginalized in our communities, which include gender, sexual, ethnic, immigrant minorities, especially intersectionality among those statuses, and really help increase that access to care to individuals who need it the most. And we will underwrite the cost of services for these clients, and the therapists, the providers, are not taking a loss in working with these clients. So it's less likely for them to be disgruntled. Burnout is not a thing as much with us because we really try to take care of our staff just as much as we take care of our employees. And I like to think of us as the trickle down compassion, so that we're taking care of our people just as much as we want our people to take care of our community. So with that model, we really try and spread the word about what separates us so that we can help sustain the needs, or sustain the ability to help the clients that have these needs in our community. And welcome your help in this path and work that we're doing. And thank you very much.